So I'll call the membership meeting at 2:03, and we'll just clear out some of the other business, and then we'll get into our guest. So, Brandon, if you want to throw up the minutes from the last membership meeting, which was back in June. Okay. Everybody's had a chance to kind of review the minutes of the last membership meeting. I would accept a motion to approve those minutes.
Also make that motion.
Okay, Dr.
I second.
Jared seconds. All in favor say aye.
Aye.
All opposed? They stand approved. I'll give a fast update on our treasurer's report. Through August, we had a margin of $5,950 for the year. And on our balance sheet, we have $16,330, and we have no liabilities. And so our equity as of August 31st is the $16,330. That treasurer's report was approved by the board, and this was just bringing facts to the membership. So those do not need to be approved. They already were approved. Okay, I think we have some other business, but first, I think we'll go to our guest, and for our guest, I'll have Dr. Brunet do the introduction for Judy, and then we'll turn it over to Judy. So Dr. Brunet, if you'd like to do the introduction.
Thank you, Ron. I appreciate it. U.N.I.T.E Fellows, I'd like to introduce Dr. Judy Goforth Parker. Judy and I met probably 16 plus years ago at the Chickasaw Nation when she was the CEO of the healthcare system. She now is, and I'll let her share her real title. I call her the Secretary of Public Health Policy for the Chickasaw Nation. Little fact, when she first got this new assignment by Governor Anna Tubby, she called me up and said, "I've never had a public health policy class. What can we do?" And I was like, well, I happened to be walking just by Meharry Medical College Center for Public Health Policy, which was a Robert Wood Johnson Center. And I just literally made a right turn, went in and said, "Tell me about it." And so we went back to school together. I won't tell you what our ages were, but she's much younger. So, but that was the beginning of it. And we both, we graduated. They didn't kick us out. So, but here's Dr. Judy Goforth Parker.
Thank you, Kendall. Thank you, Ron. And I know that I've met you before virtually, and I'm not sure I've seen your face on some of those calls, but my understanding is that you were wanting an update from the TTAG. Yeah. And I serve as the co-chair of the TTAG with Chairman Ron Allen, and he's the chair. I've been on the TTAG now, I think probably since 2009. I'm pretty sure that's it. And there are several subcommittees on that. And one of the subcommittees is the long-term supports and services. And I'm sure that that's where we met. And so I thought I would give you a report on what we're doing with long-term supports and services, and then just see if you have any questions. And you probably know, and I know, Ron, you know this probably better as well as anybody, and probably Kendall does too as well, but the long-term supports and services definitely is a part of the Indian Healthcare Improvement Act, but it was not ever backed by funding. And so it makes it kind of a challenge. We're very fortunate to have several federal partners that participate in those calls with us, and that includes the Indian Health Service. And so fairly often Dr. Bruce Fink, participates in our calls as a representative from Indian Health Service. And then the other one would be the Administration on Community Living. And Cynthia LeCount attends those meetings quite often. And so one of the things that we're doing right now with CMS, and I say we because they keep reminding me the federal partners have to do this. And so I'm not a federal partner, but we're working on a memorandum of understanding. It was first done about, I think it was in 2011. It could have been 10, but somewhere in that time frame. And those three federal agencies put together a memorandum of understanding that had quite a few goals and objectives that they wanted to accomplish. And John Johns, who is the CMS person that represents us and helps us get everything together, fortunately was on in his position even at that time, so he was very involved in it. And of course, Cynthia LeCount was very involved in it. And so we are in the process of trying to encourage them to renew that MOU. We pretty well did a lot of the things that were in the MOU. One of them was to have the roadmap for long-term supports and services that is on the CMS webpage. And then the other thing, which I know that you all talk about as well, and that's the webinars that are done regularly. And I know that the Chickasaw Nation has done a couple of those, but those are some things that we're proud of that were done. The other thing that, and boy, did I just start talking. I just jumped in, sorry. But anyway, you wanted a report, so I'm gonna give that, and then if you have questions. But the other thing that I think is pretty neat is that we have a strategic plan that the TTAG does with CMS, and long-term supports and services is what I would say very well represented in that strategic plan. And so we as a committee or a subcommittee have gone back and looked at the strategic plan to see, are we doing what we said that we would do? And one of the things that we're working on right now with CMS is to make that where the other committees are doing more like what we're doing, so that we do a quarterly update and kind of keep ourselves all accountable, and so that it's not what you call an exercise in futility. You put together a plan and then you never look at it till 5 years later. So that's one thing that's going on. So the strategic plan, that's an update. And then about the MOU. And the other thing that we're watching right now is something that's come up in the Federal Register that I know you all are all aware of, and that's the legislation that they're talking about that would impact tribal nursing homes. And so even, though a lot of tribes do not have nursing homes, it's still something that comes up in our meeting. And so the long-term supports and services subcommittee is talking about that. And then the other one would be the TTAG, and I'm gonna have to try, boy, there's so many committees and so many names. I have to see if that one will come up. It's the one that looks at federal regulations. So they keep a running list of the federal regulations that impact tribes. And so of course that one's bubbled up, and it will be on that one as well. I think it happened last year as well, and we made comments related to it just because of the concern of the negative impacts that we think that it would have on tribal nursing homes. And it seems to me, and I did not make a list, I don't know why, because I think there's probably one more thing, and I may think of it and maybe not. You probably have heard enough of what we're doing on that committee, but it's kind of nice. Ron, we've missed you. We've invited Kendall, and he hasn't ever gotten to come. Cynthia LeCount is she or someone from her team is pretty well always involved. And oh, I know what it was. The other one is that we've had presentations done by the 5 states that have the Money Follows the Person Tribal Initiative programs. And so that's been an interesting discussion, and we've had presentations by them. And in the last one that we had in June where they presented, they actually asked to be placed on our agenda, and they addressed some concerns that are going on in those 5 states related to some of the care or maybe lack of care, or probably what you would also call it care coordination. And I will give an example of one of those things is that, say for instance, somebody gets, they need to go to a hospital. So they have an ambulance take them to this hospital, and the ambulance didn't take them back home because that's not a part of the contract. And so here you are, maybe 100 miles from home, and this one of the persons actually just started walking. And so another person who was discharged from home, I mean, from the hospital, and just ready to go home, and they're standing there in their little cloth booties and, cloth hat with elastic on it, and they're in a northern state. And so there are things like that that are being addressed. And so CMS is right now in the process of looking at that with us. But those are some of the things that are actively going on in our committee, the Long-Term Supports and Services Subcommittee. And because it doesn't, there are a lot of funds that are generated for that, or, totally inadequate funding. It's not wildly popular, so I don't have a whole lot of people come to that meeting. But anyway, we still meet and we still address the issues. And so I appreciate being invited today. And I will stop at that. You didn't give me a time frame, so I'll stop there and see if you have questions.
Does anybody have any questions for Judy? We appreciate her work, and like she said, she's been on that committee for a long time. We kind of sometimes mesh and get involved. We seem to be fairly busy working with tribes on exploring them having their own nursing home. So we like to keep our ear to the ground on that particular TTAG. But does anybody have any questions for Judy? Well, we appreciate you taking the time, Judy, and kind of explaining that TTAG a little bit. The fact is, if the tribe will jump through those hoops for a nursing home, then CMS will pay for their folks that are on Medicaid. So it does make a big difference.
I guess a question that I have, Ron, to Judy is are there issues or action items that we might be able to help you with if we funnel up priorities to you?
Well, definitely, I think the questions to be funneled through that subcommittee are appropriate. And if you all even ever wanted to be a guest on there, I think that would be, that would also be good. The one thing that I think to remember is that in just last, with the meeting it would have been this month, somebody asked for a list of the facilities that, the tribes that do have a nursing home. And so John's shared that with all of us. And we know that that's the care of elders is definitely something that's very much, it's a concern to everybody. And as Ron always said, Ron Allen, he said, because I am one, anyway. And he said, so we want to be well taken care of. He's always saying that. But I think, just seeing how the other thing that there is Medicaid reimbursement for a lot of the services that tribes are providing already. And it's just figuring out how to make all those wheels align and, go in the right direction.
So it sounds like we might be able to funnel up some stuff to her, Ron, and at least give an update of what's going on from the U.N.I.T.E natives.
I think that'd be great, Kendall.
Yeah, your names were brought up. We were talking about you the last meeting, so. But thank you for inviting me today.
No, thank you for participating. We'll probably ask you to come back sometime, Judy.
Okay, I'm not bashful. I'll come.
Okay,
I enjoy sharing what's going on, and I think just all of us staying involved, just realizing and maybe like even as we write that MOU, it might be something that you would be interested in seeing. Because it's, it pulls together a lot of different entities, and if you get, I know, and I know that Dr. Fink, right?
Bruce
And
Fink.
yeah, he has some real interest. A lot of his, it seems to me, he's very interested in Alzheimer's and dementia care, but I think it takes all of the agencies figuring out how to work together because the funding path is just not as clear. I call it a jagged line. So it's there, but it's just figuring out how to make it work. So thank you again.
thank you very much. Okay, then I think we'll go on to the next item. And, some of you were on the last call for the board meeting, but we will be having our annual meeting in Chicago with Leading Age. And Leading Age, I believe, is the 5th through the 8th or the 9th. We're going to have our annual meeting the afternoon of November 7th. Our annual meeting will start at 2:00. We'll have the internet connection so that we can invite the membership, and we'll probably start that somewhere around 2:30. We'll get that information out, and then people can participate in the membership meeting on November 7th. Some of the major items that we need to accomplish at the annual meeting is we will need to have an election of officers. And so everyone on this call can be thinking about that. And, we'll just throw that open. We don't have a nominating committee per se. Maybe that's something we could think about in the future, but I don't think we have time to get that established for this annual meeting. But we are going to have an election of officers. And then during that period of time, I think that we will have some time to explore how to increase our membership, how to get other tribes involved. And I know that's probably the next biggest item we need to concentrate on at the annual meeting. So put your thinking cap on for those items too. We had Amanda was able to give us a little update about Leading Age. Was there anything you wanted to add to the membership?
Just, I'm not sure if Amanda talked about our advocacy efforts about the proposed staffing standards, but I'm sure you've all seen them and you're all digesting them. It seems to have taken all of the air in the room and consumed everybody's last waking moment. But we are preparing a number of different routes of advocacy. We just today we got up on our website our guide to submitting comments, and I can drop that into the chat on this call so that you guys have that. We're not doing a template, like a fill in the blank template, because we want to get as many unique comments submitted as possible, just to make sure that CMS is attending to our concerns and that we're telling our stories in the most impactful way. In addition to that, we're working on some Hill strategies. We've had a few member town halls, which are available on our website. You got to use the Leading Age login, but everybody is eligible for a Leading Age login. So you can access those. We've got a few nursing home network calls coming up where we'll talk about the rule. And we're going to have an action alert out tomorrow that will come through your email, and you can just click on the link to submit the comments directly to the Federal Register, and then a few other advocacy activities that we're working on and we'll be rolling out. But yeah, we're doing everything we can so that everybody's concerns can be shared, because it's it's significant. What's been proposed is significant, and the issues with it are significant.
Absolutely. I don't know how the nursing homes can comply with them.
Yeah, I don't, right? And that's the thing. It's like, I don't know how we're going to meet these standards if they are finalized. And if they're finalized and we're not meeting them, what does that look like, right? That's people not accepting admissions, that's nursing homes shutting down. I mean, really, what is going to happen here? What does CMS expect to happen here? And we can't really be looking at crashing the healthcare system, right? Like that is not a viable option. And so what else do we think? What else does CMS think is going to happen here? It's a really like bewildering situation, I think.
I would agree. We appreciate the update. So I would just like to invite everybody to Chicago and participate in the our annual meeting if you can. And if you cannot, then we'll set up the Zoom so you can participate that way. But more the merrier, and get me a head count so I can get that to Amanda with Leading Age so they can kind of help set up the room for us. So that would be good. Dr. Brene, did you have anything else you wanted to add?
I wanted to let everybody know that with support for Travis at the TO Nation for administrator in training, yesterday he did pass his state and his federal for the first time. Woo! So he is NAB licensed. So that's our. We kind of went hand to hand with him for about 8 months and got them through that. So Melissa, you got somebody else, and Deb, you got somebody else in there that's licensed and raring to go.
Well, that's exciting. Thanks for your help with him because he was certainly wanting to do that. So that's awesome. Well, gang, I don't have anything else for today. If anybody has something, I'll leave it open here for a few seconds to give you an opportunity to jump on and say whatever you'd like to.
The other update from the Arise side of things, we did get our funding for our next ag grant, so that'll help us with getting the fees for matching to U.N.I.T.E natives. So that'll be forthcoming in October.
Well, gang, we'll have one more board meeting in October prior to the meeting. So if you think of something, just holler, and I'm sure Joseph or Ina will be able to attend at that time. So thanks for jumping on, and we'll talk to you soon. Have a good day.